So this is a little bit of a review. There's 2 or 3 other talks on YouTube that are other reviews from previous years. This is just the drugs in the past year or so. I am very hesitant to use a drug until it's been out for 5 years or so, but that doesn't mean that other people aren't going to use it, and so we should be familiar with them. You'll want to know them really well before you go to the next level of prescribing them. All right, related to pharmacology is the fact that we're doing more and more cytochrome P450 testing. Gallery is an example of a drug that, or I'm sorry, of a test that is there to look for various types of cancers, and also there's the various testing for cytochrome P450. Cytochrome P450, there's a good article in the Nurse Practitioner, and I encourage you to look at that. That's going to be the wave of the future. All right, so Xolair is a medicine that's been out for a while. It's a monoclonal antibody. Anything that ends in mab is a monoclonal antibody. And this one particularly attacks allergy cells. I think it's mast cells. And so it's actually used now, or approved now, for people that have type 1 allergic reactions, in other words, anaphylaxis. So if somebody has had multiple cases of anaphylaxis, they might be started on Xolair to prevent that. I guess they also could be started on it if they were starting to be exposed, to bees or something like that. We've used it for some time for eosinophilic asthma, urticaria. Chronic rhinosinusitis is probably a little bit controversial just because there's lots of other things we can use that are not as expensive, but it is approved for that as well. Kisunla is a medicine that is for Alzheimer's disease. There's 2 or 3 that are coming along. They basically block the production of the amyloid that deposits in the brain. There's interest in using these drugs for other things, including heart and other issues, but there's other drugs that are actually being used for those as well. ApoE is the protein that is involved in producing those plaques and tangles. And so if you have the genetic predisposition to that ApoE gene, I think it's 2, 3, and 4, then you really might be a candidate for this. There are some amyloid-related imaging abnormalities that are something we should be aware of, but it's also one of those things that is on the horizon. I haven't seen anybody on these medicines yet, but I think that between the Kisunla and the Leqembi, we're going to see more and more of these over the next several years. Vabysmo, there's ads all over the TV for that one. It is about $2,300 a dose, which means they can afford to put some ads on TV. It's useful for wet macular degeneration, diabetic macular edema, and after retinal vein occlusion. It's obviously an eye doctor medicine. Doesn't really seem to have a lot of interactions or implications for other prescribing. Winrevair, cetate. Sept is a suffix that means that the medicine is forming a complex with a receptor of the immunoglobulin G molecule. And so there are a lot of sept medicines out there. Monoclonal antibodies and sept medicines are the 2 big ones right now. This particular one is for pulmonary artery hypertension, binds to the protein activin, and interferes with it and prevents the progression of pulmonary hypertension, period. Sound like I'm dictating. Zevtera is ceftoprobol. It's in the cephalosporin family. I think it's a distant relative. It is for bacterial skin infections and community-acquired pneumonia. It's obviously not used for basic infections, but it is important to know that there are antibiotics still coming out through the pipeline. Bequevs or Becvez is got cogene in the title. It's actually a gene therapy that's basically used for hemophilia B, which is the less common one. Hemophilia A is the more common one. Neither is particularly common right now, but it does really decrease the need for factor IX infusions. It is something that is on the horizon. This and a medicine for sickle cell are really the two that are in this talk that I think are really pushing the barriers of genetic therapies. Lyfgenia is the sickle cell one. It basically alters the genetic function of the individual and decreases their risk of having a sickle cell crisis. It's a pretty major advance. There was another one similar to it that has been withdrawn, but there are these drugs in the pipeline. Trivio is a new antihypertensive. It's an endothelin receptor antagonist. We do need probably new options for hypertension treatment, although the ones we've got are really quite good. And it blocks the binding of endothelin 1, A and B, and it stops that vasoconstriction. Again, I think it's a pretty major scientific advance. I'm not sure that clinically we're going to be using it much, but it's good to know it's out there. Romenadine is another option for hypertension treatment. It's being used aggressively in Europe. It's an imidazoline analog and decreases blood pressure. It's got 2 or 3 brand names, none of which are approved in the United States yet, but I do think it'll be coming. Zoloracerian is probably maybe the most important of the drugs that we're looking at in this review. LPA, Lp(a) is an important factor in lipid causing heart attacks and strokes. We really have no other drug that lowers Lp(a). The only thing that's approved right now is pheresis. And unfortunately, that's expensive and hard to access. This drug is, I believe, in stage 3 trials, which means it's probably getting ready to be released to the public. And it works by targeting a particular RNA sequence on a particular lipoprotein. So I think it'll be interesting to see. I think it's coming, but it'll be really interesting once it comes out to see whether it works the way we're hoping it will. Resdifra is a thyroid receptor antagonist. Interestingly, it's for treating what we now call MASH or MASLD. We used to call it NASH and non-alcoholic fatty liver disease. Now we call it metabolic associated dysfunction. And so these drugs really do seem to decrease the probability of that. I have a lot of patients that have slightly elevated liver functions. Then they have a ultrasound, which seems to show a fatty liver. And mostly we watch them and keep rechecking their levels. But it'll be interesting to see if we can intervene at some point and decrease the progression of liver disease. Zelsuvmi is a gel that's used for a molluscum. Molluscum usually lasts a year or more. It can be kind of aggravating. We can freeze off the spots, but unfortunately that can be uncomfortable and it's hard to do enough to really make a difference. But this is out now. I assume it's fairly expensive, but it'll be interesting to see if the dermatologists start using it. Sofdra, sofpironium, is an axillary hyperhidrosis. I probably have 6 or 7 patients a year that come in and say they have excessive sweating. You use the prescription strength deodorants, the 20% aluminum chlorhydrate, and it does seem to help some. Some people use a beta blocker, some use an anticholinergic, but there's no great choice. This one seems to be a sort of selective anticholinergic effect in the armpits. but it does seem to have some general effects. It'll be interesting to see if it takes off or what happens with it. Ordavari is a COPD drug. PDE3 and PDE4 are important medicines, are important receptors or neurotransmitters in the lungs, and it blocks those and decreases the effects of COPD. Amvuttra is important for amyloid that's deposited in the heart. We have patients that are having progressively worse heart failure and often need a heart transplant. It's an uncommon disease, though, so it is kind of an orphan disease. But for those few patients that have it, it's nice to know that there is at least some options for treatment at this point. Interstitial lung disease, there is a couple of drugs at least on the horizon. Interstitial lung disease is a broader category, but interstitial pulmonary fibrosis is really what the Esbriet and the OFEV work on. We don't really understand how they work, but we do know that they seem to decrease the interstitial changes and preserve lung function for longer. May have complications, may increase clots. It'll be interesting to watch and see what happens with that, but it does seem to be a pretty major advance.